Hey, welcome back. So this week marks Black Maternal Health Week in a growing push to address, let's just call it what it is. It is a crisis that continues to impact families all across the country, especially here in Georgia. Black women are far more likely to die from pregnancy-related causes, even when the income and education is the same. So that's not the problem, right? Health experts say a lot of these deaths are preventable, but systemic gaps in care still remain. According to the CDC, even with similar income or education levels, Black women face up to 3 times higher maternal death rates. It also finds that more than 80% of pregnancy-related deaths, again, preventable. Meanwhile, the State Department of Public Health finds that Georgia ranks among states with the highest maternal mortality rates. So let's take a closer look at what is the driving force in these disparities and what can be done. I'm here with Dr. Crystal Welch, the co-owner of the Oasis Women's Wellness Center in Buckhead. So, Dr. Welch, when you hear about these numbers, what do we see is the main cause in the root that we're seeing of this health crisis for Black women?
For Black women, the cause is multifactorial. So there are in Georgia these things called care deserts, basically where there's no access to good maternity care for miles, sometimes 45, 60 miles between hospitals that can care for maternities. And then also Black women do not have the support systems from the healthcare system that they need. Sometimes they're not listened to, sometimes they don't know how to advocate for themselves. They are facing higher comorbidities that also can complicate their pregnancy outcomes.
And so when we hear these things and we see these videos on social media, there were a couple recently of the lady, basically in active labor, turned away, told to go home. And there's also racial disparities, like it was white people on the end saying, this isn't to be taken serious and putting them in situations where they're losing their lives. Mm-hmm. Do you feel a certain level of responsibility being a Black woman, OBGYN and healthcare to sort of show up in that way to address this crisis?
Absolutely, absolutely. I am always advocating for my patients and asking the family members also to advocate for them. When we're in office, I counsel them regarding some of the signs and symptoms to look out for, and also review it with the family members to make sure that they are understanding what the patient should be going through and what's normal and not normal.
I know preeclampsia, we talk about that one a lot. Any certain things that the women or these family members should be looking out for if they feel like, something isn't right? Is this something to kind of sound the alarm about?
Yes, absolutely. Preeclampsia is very, very common, and it's getting more and more common amongst Black women and Hispanic women. Specifically for Black women, we need to be looking at headaches that do not resolve if you take any type of pain medicine like Tylenol. You need to be looking at any non-dependent edema, meaning swelling in your face or your hands, pain in the right upper side of your belly, any blurry vision or things like that. Those are clear signs of preeclampsia.
What are the most effective changes that you could think of to say, like, look, if we just all did this, this would be better? What are some of those things that we just all need to sort of put a light on?
Education, one, but also once they get to these healthcare systems, if they're not maternity equipped, to just know protocols, like to have certain guidelines that say if a woman presents with this, this is what you should be looking for, this is what you should be evaluating for, and this is how you would treat it, and getting her to the proper places that she needs to be.
When you tell a patient to advocate for themselves, what does that look like? Because you feel so small. I remember going to these appointments and we think you guys are just the smartest and the brightest, and which you are, but it's like, well, who am I to tell the doctor something different? What does advocating for yourself actually look like?
It looks like, one, it's more important for you to find a doctor that you can talk to, that you feel comfortable with.
Yeah.
That if you say something to them, you know they're going to listen. So if you see that's not who your doctor is, you should change doctors. There are a lot of Black physicians out here, and they don't have to be Black, but you can find someone that you're more comfortable with. And just speak up, speak your mind, and that's why the partners also come into play, where we tell them, you can speak up for this patient as well. If she's saying, my head's been hurting for 2 days and I said that, but they didn't hear me, you say, hey, she is complaining of a headache that has not gone away. Can we get a little bit more? If they're not listening, there are always other people you can ask. There are managers on the units, there are managers in office, there are other doctors, there are mid-levels, there are different people that you can just keep asking and persisting to listen to you.
She persisted. All right, Dr. Krista Welch, thank you so much for being with us and giving us hope about Black women surviving having children. Stay with us. We'll be right back.